Hello, my name is Andrew Smith. I'm a hand and wrist surgeon based in Kent, and this is a short presentation on thumb base arthritis on behalf of the Kent hand and wrist team. Osteoarthritis is one of the most common problems presenting to the doctor. The joint between the metacarpal and trapezium at the base of the thumb becomes degenerative or worn out. The patients present with pain, in some cases a crunching sensation at the base of the thumb. These symptoms are worse with pinching or gripping and can be really quite debilitating, making hand use really quite difficult. X-rays of older females show that approximately 25% will have X-ray changes of osteoarthritis at the base of the thumb. This just shows how common this problem is. Treating thumb base arthritis is very similar to treating any other arthritic joint. The patient can modify their activities so they're not putting as much force through the joint. This will reduce the symptoms. Taking simple painkillers will help reduce the symptoms. Physiotherapy or hand-based therapy can help support the joint and reduce the symptoms. Consideration can be given to using an external thumb splint. If these non-interventional therapies don't allow the situation to be helpful, intra-articular steroid injections can be helpful. If none of these modalities settle the situation, consideration should be given to surgery, which is extremely effective. Trapezectomy might still be considered the gold standard surgical procedure in the UK, and what a lot of patients will be offered. It does work well to relieve pain. The trapezium is removed and a false scar tissue joint is formed, as you can see on the right of these two X-rays. Recovery, however, can be relatively slow and take anything up to 6 months or even longer on occasion. Patients often feel that their grip is weak, and that's because the joint is not mechanically reconstructed. Our preferred option for most patients is a formal joint replacement. This has the advantages of quicker recovery, and most people are in pretty reasonable shape by 3 or 4 weeks. They will often have better grip strength than an equivalent trapezectomy patient, and that's because the joint is more anatomically reconstructed. It does, however, come with the potential risks of any joint replacement, and there can be problems with wear, loosening, or dislocation, just like a hip replacement. Thumb-based joint replacement is not universally offered in the UK, although more specialist hand surgeons are offering this procedure, but it is the standard of care in France and Belgium. We have extensive experience with thumb-based joint replacement and have taught on courses to help train other surgeons. Thanks for listening, and if you think we can be helpful managing your thumb base arthritis, please be in touch.